So in 2013, one of Stanford's global health research, Clea Sarmquist, came to me to talk about maybe investigating this intervention that had been running in Nairobi, Kenya for a while. And it was a really interesting set of questions. So this intervention looked like it was pretty effective at reducing the rate of sexual assault, and in middle schoolers, high schoolers, so young folks and people who were in tough environments. So in the settlements of Nairobi, Kenya, these are not easy places to live, and this organization had built out a program. They'd worked on it for a long time, thinking about what skills could we deliver, what behaviors could we teach young folks that would help them reduce the rates of sexual assault. And that kicked off a whole line of research. So I'd never worked in that field before, but really tough. Like we may believe that it's working, but to think about how do you measure that? How do you prove that? How do you reassure yourself that the energies you're putting into this are really doing the right things? And so we were able, in partnership with some pretty amazing organizations, work on two very large randomized trials, and randomize this program to different schools spread out through the different settlements around Nairobi. And we've been running randomized trials now for 6-7 years, and that's been pretty amazing. And so because that's a really young science, there hasn't been a lot of empirical investigation of programs that people think might prevent sexual assault. Our team could make really big contributions early on. So I've been, fascinated. Not only was I the sort of person who designed the randomized trials for these, but then got to work really closely on, thinking about deploying it and what are the correct measurements, what are, the ways that the program might evolve. And that's been fascinating. From there, our team helped to bring a different program that was developed by these amazing Canadians at the University of Windsor, who developed a program very similar to one that's being running, or conceptually very closely related to the one that's been running in Kenya for a while. They developed this amazing intervention, sort of like over the course of a decade, and they were able to show that they were able to drop the rates of rape in college-age women by about half. Pretty phenomenal program. And so we worked with them to bring that intervention here. And then we're going to be running a randomized trial probably like this time next year here at Stanford. We've also partnered with some other universities, so University of Arizona, Cornell, Georgia State, UMass Boston. It's going to be a pretty amazing randomized trial looking at whether this intervention can prevent rape here in the United States. That's been really fascinating. And again, it feels like we're able to make some real contributions, to know if the program works, know how much it works. And we started to think about like why it works. So there are theories, but then, and those have been developed by very careful thought. And then the question for a team like ours is like, can we demonstrate that those pathways are working, that the reasons we think it's working, they're in fact working? That research has been really quite interesting, and it has allowed me to sort of meet a bunch of other researchers. In the last 2 years, I've gotten involved with a team here at Stanford, and we call ourselves the Human Trafficking Lab. And it's a couple of economists, anthropologists, medical doctors, and we also have a prosecutor. This prosecutor is from Brazil. He's one of the federal prosecutors there. And he's been working on human trafficking, disrupting human trafficking, and prosecuting human trafficking, investigating human trafficking for decades now. And so he's also a computer scientist. So he brought together a lot of the data sets that Brazil has been collecting, thinking about human trafficking and disrupting that. And right now we've been thinking a lot about labor and how labor has been trafficked both into Brazil and out of Brazil and across different parts of Brazil. And we've been building out these pretty impressive algorithms, I think, thinking about can we automate? Can we make a lot of what the prosecutors are doing faster? Can we have satellites that are going over the Brazilian rainforest, monitoring and looking for some of the telltale patterns of human trafficking? And that's been extremely fascinating. We've been working, multinationals. We've been thinking about what we can do to help, and it's been really rewarding.